All right. Thanks so much for having me and to everyone for being here. It's great to be with you all this afternoon. Like Sylvia said, my name is Molly Costigan, and I've got 6 years of history with Sustainable Food Center and 4 with our specific cooking and nutrition education program. I know one of the requests today was thinking about resources for diabetes prevention and management. That's not something that we do as specifically, but I think a lot of our models and ways that we found that work for us could work for a lot of you. So I'm very excited to be here. I'll also point out that this cooking and nutrition education piece of the Happy Kitchen, it's a much bigger part of a much bigger food systems initiative from Sustainable Food Center. So as part of my introduction, I'll talk to you about some of our other programs, because we also know that for someone to access healthy food, to improve diabetes outcomes, there's a lot more than just what to eat. It's, can you access that food? What do you do with it? Can you afford it? So I think this bigger piece of our Sustainable Food Center picture will be helpful as well. So I've got some objectives here for the presentation today. I'm going to go through the history of Sustainable Food Center and the Happy Kitchen, our program, demonstrate how the Happy Kitchen fits into our greater food access work, review the current structure of our community cooking class series, and then share those best practices for providing accessible, peer-facilitated cooking and nutrition education as it may relate to diabetes prevention and management work that y'all are doing. I'll also wrap up with some future opportunities and challenges that we've seen here at Sustainable Food Center, and then we'll take some questions as well. All right, so Sustainable Food Center is an Austin-based nonprofit organization. As of right now, we just work here in Central Texas. Our mission is to cultivate a healthy community by strengthening the local food system and improving access to nutritious, affordable food. And when we think about that access piece, for a lot of people, what comes to mind is the idea of a food desert, your geographic access to food. Can you get to a grocery store? Can you get to a place that sells food? And that's definitely something that we think about. We also think beyond that to other forms of access. So we think about financial access, that once you get to that grocery store or corner store or farmer's market, can you afford to buy food? Did those outlets accept methods of payment that you have? If you receive those government food assistance benefits, the SNAP or WIC program, are you shopping somewhere that accepts those benefits and where those benefits go as far as you need them to go? Access is also cultural, that once you get to the store, are you able to buy things that fit with the way that your family wants to eat? And it's also related to the skills and knowledge piece, that once you get the food home from the store, the farmer's market, the corner store, do you know what to do with it? So the easy way to think of our 3 main programs here at Sustainable Food Center, the vision piece of how we work, is enabling children and adults to grow, share, and prepare healthy local food. And I'll walk you through those 3 programs now. Well, I'll start with our history. We do have roots going back over 40 years. Sustainable Food Center started as Austin Community Gardens. They were founded in 1975 and became Sustainable Food Center later. We've got that seed to table approach, and one of the biggest factors in changing some of our programs that I'll address later is that back in 2013, we moved into our own teaching facility. So we do have a full teaching kitchen on site, as well as a teaching garden. And that's been a huge difference for us. We used to office out of a tiny office suite in an office building. We had 9 of us sharing the conference table, the conference room as our office. And so this has really helped us expand our program and have a home base where we can invite folks to come back to us. Although most of our free programming still does happen out in the community where people are already gathering. So with that first grow piece, our Grow Local program, that's the garden side of things. We find that gardening is something that a lot of people are interested in, but don't know how to do or lack resources to do. And it can be a really affordable way to access healthy food, especially if you live far from a grocery store, or if you want to get something that's super fresh and convenient. I have a little garden plot, and I feel like herbs have been a huge thing for me. It's where I get the most bang for my buck. I can buy a basil plant for the same price as that plastic sleeve of basil in the grocery store. And when we talk to our participants, we talk a lot about how using herbs to flavor your food instead of salt and fat is going to create something that's even more delicious and also healthier for you. So with our Grow Local program, we provide support for home, school, and community gardens. We don't actually run gardens ourselves, but community leaders come to us, let us know that they're interested in starting a garden, and we can provide the support to them. So we have garden leadership team trainings for both school and community gardens. We have free and fee-based gardening classes that anyone in the community can sign up for. It's a 3-part series with information both on container gardening, how to grow on your balcony, or in-ground gardening for folks that have greater access to land or who might have a plot in a community garden. And we also have a project called Spread the Harvest, and that provides free seeds year-round and free plants and compost twice a year to gardeners who are low income and to school gardeners. So that's a big piece of getting people started with some resources on their way to growing their own food. And with our Teach and Garden, we're able to host school kids on field trips to get them thinking from an early age about growing healthy fruits and vegetables and just getting excited about vegetable consumption in general. Nope, we're going the wrong way. So the Grow, Share, Prepare, the share piece is our Farm Direct program, and that's all about connecting farmers to customers. How we're most known for that in the community is that we run 2 of the largest farmers markets in Central Texas every week. There's 2 locations for those. And we also do some farm to work, farm to school. We started by running the farmers markets, and then by connecting with farmers, realized that many of them were looking for ways to get that great produce into the hands of the consumer, both because it's great for you and nutritious and they want to serve the community in that way, and also because they need to make a living. So we do see our clients both as farmers and consumers, and we try to create sales opportunities whenever possible. But we also know that historically some of that farm fresh produce has been out of reach, not affordable for many in our community. And so that's why we have our Double Dollars program. So we have a program at our farmers markets as well as some community farm stands that allows us to double the dollar amount of SNAP and WIC benefits spent at the farmers market. There's also a program through the WIC office that's called the Farmers Market Nutrition Program, so that clients who receive WIC benefits get extra money in the summer just to spend at farmers markets. So it's not affected their regular benefits. They still get what they've always been getting, and then they get this extra on top of it for farmers markets. And so we can double all 3 of those. We also recently launched a triple market day where once a month we can triple what people are spending. So you come to the market, you spend $10 on fruits and veggies, and you get this colorful, looks like play money script. It doesn't expire that day. You can spend it any time, and it helps you stretch your food dollars to buy that fresh produce. And that's been a really big hit, and it's something that we do a lot to promote in our cooking classes too. And the cooking classes, that's where we will focus today. So the Happy Kitchen La Cocina Alegre program offers community cooking and nutrition education. Our goal is that when we're cooking, it should be delicious, nutritious, also seasonal and affordable, and accessible. So we try to keep the recipes quick and simple, things that people are going to want to make over and over again, and also try to teach them in a way that you don't just leave our class having learned to make tuna recipes, but that you learned some general tips that you could apply to anything. Once we moved into that teaching facility that I mentioned back in 2013, we added some fee-based classes as well. And so the fees from those classes help us pay for the free work that we do. So some history, how we got started, and also why we say our name in Spanish, is that the Happy Kitchen started as a Spanish-only program. It started in the mid to late 90s and has developed a lot from there. So that's why we've got so many lessons learned to share. Initially, the program was chef-led. So we had lots of Spanish-speaking chefs in the Austin area who wanted to help us provide this cooking and nutrition education. But what we realized is that chefs have very unique schedules and they don't always match up with the schedules of folks who are looking for that information. We also realized that it's very easy to believe that someone who's been to culinary school, been trained as a chef, that they can get a delicious, healthy dinner on the table. It's a lot harder to believe and more exciting to hear from a mom of 3 kids who's working and getting back and forth from soccer practice and running the farm stand at her school, that person is making dinner on a regular basis. So we switched to a community facilitator or promotora model. So it's community members, most of whom are past class participants themselves, who we send out into the community to teach our classes. It does mean we sacrifice a little bit. Not all of them have formal nutrition, culinary, or medical training, but I think all of that we sacrifice, it's more than made up for in the relational aspect they bring to the classes. People are really comfortable talking to them, asking questions of them, things you might not want to ask of a chef of, what does boiling water look like? Do I need to buy a knife like that? People are really comfortable engaging with the facilitators in that way. And when we're delivering the classes, we looked at several other curricula that were out there around cooking and nutrition education. I know Cooking Matters is a curriculum that is likely still available, and that is one area where we drew some inspiration. But we really wanted to be able to teach something that was specific to Central Texas when we're talking about seasonal eating, and also specifically able to connect folks to all of the other resources that Sustainable Food Center has to offer. So we do have our own curriculum. It's not currently available to other organizations. We used to make it more widely available. We trained a couple of groups to replicate it in their communities, but we found that the integrity of our program, the things that I'm going to go through here in a few minutes, are what make it so great. And we didn't want anyone leading a Happy Kitchen class and not adhering to all of these components. And so the burden on us to do those quality checks and keep up with everything was a little more than we're able to handle. So I won't be connecting y'all with a curriculum that you can replicate or buy, but I do hope that you'll be able to take away some tips and tricks to take back to your own work. And then, yeah, the other big piece of our history is that teaching kitchen. So we went from the 6-week community cooking class series. That's how we started. We still run that today. And that's what I'm going to spend the most time on during the rest of this presentation. But as a result of having a kitchen on site, we also added some follow-up classes for past participants, and we added public and private classes that help us generate revenue to continue our programming. The follow-up classes, we do about 24 6-week series every year, and we do 10 to 12 follow-up classes. Those are just held at our location, and so we offer transportation assistance to help folks get here. And we chose the topics based on participant feedback, things that they wanted to know more about after they had taken the class. So some of the ones we've been doing every year include knife skills, meal planning, and herbs. And all 3 of those really take advantage of having a teaching kitchen, which I know not all of you may have access to. So that's the main reason why I'll focus on the community class series. But knife skills, it's really great to have the kitchen because we can get 15 people around our kitchen island, all cutting up 6 to 8 different vegetables that they practice with and then take home with recipes. Meal planning, we could do things like showing folks a sample pantry, and we're talking them through what kinds of meals you might plan around it. And we do have an herb garden right outside our building. So we've done some cooking and gardening with herbs where people can see the garden, get inspired by how much you can grow in a small space, and then actually take home some herbs to plant yourself. And we've gotten great feedback on those follow-up classes. It used to be that someone took the class at their church, maybe they got on our weekly newsletter, maybe they signed up for a gardening class, but more often than not, we would never see them again. So this has been a really great opportunity to get folks coming back, and also a potential opportunity to do more evaluation work in the future in terms of what kind of impact this is really having. And those revenue generating pieces, our public classes, we still try to keep them really affordable. They're $30 to $40. A lot of kitchen fundamentals like knife skills, how to cut up a whole chicken. But the idea there is that folks of all income levels are looking for information about how to cook and eat in a healthy manner. And if there are folks that are interested in that and able to pay, that can help fund the rest of our programming. So those are also only held at our site. We do the outreach just on our website through some ads in the local papers, and get folks into the program that way. And we also, because people knew us as a group that did cooking classes, we started getting a lot of requests to do kind of a team building class. So that is something we offer now, mostly to organizations and corporations in the area who want to bring about 10 to 15 people. We plan a seasonal menu, do all of the grocery shopping, include a lot of local ingredients, and then they prepare a meal and eat together. So that's a little bit less mission focused for us, except in the sense that it helps us. It's a funding source for us. And I'll talk more about funding at the end too. I'll also say as an example, I know it's really lovely to hear about the things that we've done that have worked out. I will say it's taken us a while to get here. One of the things that we tried that was not successful, that I do know has been successful in other places, is realizing that someone may have already taken our free 6-week series, they may have already taken most of our follow-up classes, and they might still want more. We did a lot of surveying and asked people if they would want to join some kind of cooking club where they would come in, cook together, and eat together once a month. We still provide the transportation assistance since we've got folks all over town, but the menus could change every time without us needing to develop different curricula. And we had 15 spots available. We thought it was going to fill up because we had, 90 out of 100 people telling us that they wanted to participate in something like this. They wanted to do it once a month. They wanted to do it on weekday evenings. And we only got 8 people signed up. So it's a lesson that I've learned over and over again in surveying, that it's a lot easier to check a box on a form and say that something sounds great than it is to actually show up. So that's not something we're offering right now because we've seen some success with that in other parts of the country, other groups that we keep an eye on. It may be something we try to bring back in a slightly different form, but these are our 4 Happy Kitchen options for now. Just as an example of that not everything works on the first try. So I'll go through several components of the class. And definitely happy to answer more questions at the end about how this might relate to you. But coming back to that facilitator model and how that works, for those 24 6-week series and the 10 to 12 follow-up classes, all of those are led by our facilitator network. And at this point, we have about 45 of them. There's about 25 that prefer English, 5 bilingual Spanish-English, and 10 who are Spanish. Even though we do about half and half of our classes in Spanish and English, what we've seen is that our English speakers are more likely to work during the day, they've attended class at night, and they just want to facilitate one class at a time. More of our Spanish speakers have more flexible schedules or are not otherwise employed. They've come to a class that meets during the day, and many of them are willing to facilitate 2, 3, 4 series at once. So that's why, even though the number of classes is the same, we need fewer Spanish speakers at this point. We do recruit them from our classes. We used to have folks check a box at the end of the series if they were interested. But again, it's much easier to check that box than to really show up and get excited. So now we provide a flyer that gives a little bit more information about the expectations we have for our facilitators. You do need transportation access because you need to be able to transport class materials. You do need to be available at the times when classes are offered. You need to be willing to follow our curriculum as it's written, even if there's things that that don't fit the way that you eat. So now we're getting a lot fewer people on our list of folks that want to facilitate, but the ones that are on that list are really dedicated, and they're going to be the ones that stick around for years and years. Some of our facilitators have been with us for over 10 years at this point, and that's really the goal, is to facilitate people who want to continue doing this in the community. Once we've recruited them, we offer a 10 to 12 hour training, and it has 3 basic components. The first one is going through the actual curriculum, talking about how to deliver certain activities, how to make it engaging, how to create a class plan. We also cover culinary basics. So all of our facilitators do a knife skills class to make sure that they're comfortable demonstrating that up in front of a class. And we talk a lot about the fundamentals of peer facilitated education, why it's important to treat folks in class as adults, understanding that they're bringing lots of experience, lots of trials, things they've done before into the class, and that we're not telling them that there's only one way to be healthy or only one way to do things. We're just sharing and learning together. We do ask that folks teach at least 2 series a year so that they can stay up to date on our curriculum, on the kinds of, questions that they're getting, and so that we don't end up with a group of 40 people who we never see on our list. And we provide continuing education for them, both in the forms of just forwarding along relevant information as it comes across our desks, as well as 2 or 3 times a year when we really invite them in and lead a session. We've done some things about sustaining long-term behavior change. We've done some culinary cook and eat together kinds of things. We're going to do one this spring that has more strategies for local eating, since that's something that we get a lot of questions about. And they're able to accept a stipend for their time with us. It works out to about $13 an hour, so it's not something that most folks are doing as a career. It's just our way to appreciate their time because it is a lot of work. Not all of them accept that stipend. It's about $350 for the 6-week series, and that includes the times that they come in and meet with us as well. And then we also thank them with an appreciation dinner every year. And so this is one of the graphics that we use in our facilitator training to talk about why we work the way we do. The education of authority, where you're just throwing ideas at people and expecting them to trust you and take everything you've said and do it. And then versus the exchange of change, the presenting something and then asking people to really engage with you. How does that sound to you? Does that sound like something that you're interested in trying? One of our activities that we do, we measure out how much sugar is in soda, how many spoonfuls, and we always ask people to guess first. And when I started doing this activity, 4 or 5 years ago, people would guess, 3 spoonfuls of sugar in a soda, and they'd be totally shocked when it's closer to 10 to 12. Now, when we do that demo and we ask people to guess, some people will guess like 40 spoonfuls of sugar. And I always worry that it's going to seem disappointing when they realize it's only 10 to 12. But actually seeing it measured out in a cup of sugar is really very meaningful. But with this idea of the 2 different ways to teach, we had one participant who saw that, and the change that he decided to make for himself was that he would switch from soda to Kool-Aid, which in most cooking and nutrition education, that would not be considered a win if someone leaves your program drinking Kool-Aid now. But we were excited to see that because He was being an educated consumer. He did the math. He saw that his Kool-Aid would have less sugar to begin with, and that by making the Kool-Aid mix, he would have more control over what he's adding so that he could gradually cut back on the amount of sugar that he put in. So still not, not the dream, not that he's now just drinking water all the time, but it is, that's what we want to see, and we want to celebrate that, and that he's making that change too. So that's our facilitator model. And in terms of the participants that we get in our classes, we do a lot of grassroots level outreach. With our public classes for a fee, we just put those on our website. Anyone can find those. But with the 6-week series, while there's no eligibility requirements for who can sign up, we really want to try to reach the folks who would most benefit from a free series. So that means people who are at high risk for a diet-related disease, and that's typically low-income families and communities of color. And so to help us increase our chances of reaching those folks, rather than just putting it up on our website, anyone who has internet access and is willing to drive across town can sign up. We do a lot of flyering at Title I schools, at low-income schools. We send flyers out to our network of nonprofit partners, medical providers. We'll go to outreach events at schools and community groups. And we also work with some sites year after year. We've got 3 church partners at this point, and so they put the word out to all of their own members, and if the class doesn't fill up after that, then we invite others. So it's very strategic research, it's outreach. It's definitely not the most efficient way to do it, but it does help us reach the folks that we're looking for. And sometimes we ask our facilitators to help with that as well. We like to have about 18 to 25 people in each class. And what typically happens is that we recruit 25, they're all signed up. We get 20 people in the first class, and then by the end of this series, we're averaging about 15. That's increased a lot since I've been here. Some of the things we found that helped with that are doing reminders each week. We give folks the option to get a phone call, email, or text message reminder from us. We also always ask people to call us to sign up. It's a little counterintuitive to some kinds of community organizing approaches where you want to make your program as easy to access as possible. So when you're at that outreach event at the school, you just have people put their name on a list if they want to come to the class, and then you expect them to show up 3 weeks later when the class starts. What we found, again, with some of that, coming back to surveying and how it's not always that what people put on a survey is not always what they actually do. You sign up for a cooking class because you saw this cool cooking demo, but then by 3 weeks later, you've forgotten, you've signed up for your kid for baseball tryouts, your transportation needs have changed, and we're not at the top of your radar, which we totally understand, but we also don't want to do a class that just has 5 people in it. So when we do go to outreach events or talk to community members, we're always giving them flyers, saying all you have to do to sign up is call us. And typically the folks that will make at least that step of making the phone call are going to be more likely to show up and engage. So that's who we reach. This is the flyer that we use. If we have a specific class coming up, we'll plug in all of that information. But our classes, being a 6-week series, they typically fall in trimesters to avoid major school holidays. So we have some that are starting late September, early October to end by Thanksgiving, January, February to end by spring break, and then March, April to end by summer. So this flyer is really handy if we don't have a class going on right now. We can still tell people about what we're doing. They can call us and get on a waiting list. We've made some edits through the years. We've gotten a lot of feedback from our facilitators that it's frustrating and disheartening to start a class that's full of people and then none of them come back the second week. And we've tried to follow up with those people who don't come back, but they're not the people that are really motivated to spend time with us. So we've made some educated guesses. Some of the things we've done on this flyer are we've tried to make it really clear that you're learning recipes, not a full meal. You will get groceries to take home after class. You will get free childcare. We even have a relationship with a local WIC office. So WIC families are required to participate in a certain number of educational opportunities, and our classes can count as one of those. So trying to put out there all of the great things, but also clarify that you're getting a nutrition lesson and a healthy recipe demo, and not one of the classes that you might see on TV where everyone's got their cutting board and everyone's working together to make a meal. We also try to make sure that, you know, even though most of our class participants are women, we wanted to get that guy on the flyer to show that it is open to anybody. Show lots of people of color in our presentation as well, just so folks can ideally see themselves in this class. When we do that follow-up to remind participants about the class, we also do some more checking up on expectations so that people know what they're getting into. And so all of that outreach helps us get to this kind of demographic. So these are the numbers from our last programming year of classes. This is something we try to look at just to make sure that we're still reaching our target population. We do see mostly Hispanic families taking our classes. And classes are geared towards adults, but they'll often bring older teens with them. Some of them will bring a partner. But yeah, it's a lot of Hispanic moms taking classes during the day at schools. And the next highest group are white folks and Black folks. We would love for some of those numbers to be a little higher. Austin is a little tricky. We are one of the fastest growing communities that also has a shrinking Black population. So there's a lot of factors with gentrification and displacement in this area. We're trying not to take that as an excuse just because communities of color are needing to leave the community for various affordability reasons. We still want to make sure that we're engaging there. So partnering with African American churches has been a great way for us to do that. So in order to reach more folks from the Black community, we're trying to work more with some of those churches. We're definitely seeing mostly women. We did some focus groups last spring, and something that we heard from a lot of the women that came is that they would like to take the classes with their husbands. That they were saying, you know, I took this class, I learned how to do all of this great stuff, but then I go home and my family doesn't want to eat it. And they don't understand why we can't eat the same way we've been eating. So if you could take the class as a family, you might get more buy-in. There's not a whole lot we've been able to figure out to do for that yet. We do offer a lot of classes in the evenings and with free childcare, when ideally, if it is a two-person household, two-adult household, both of them would be able to attend. But I think there may be some bigger cultural barriers at work around if men feel like they should be in a cooking class. So we'll keep trying to make sure folks know that anyone's welcome to sign up. You also see for 57% of participants, the highest level they've received is some college. And most of our participants are ages 35 to 54. So a lot of parents in that demographic as well. These are our income charts. We saw 16% of our households receive SNAP and WIC benefits, whereas 33% of our participants were below the federal poverty line, which should mean that most of them are qualifying for those services. So in all of our classes, since we're talking about healthy eating and we know that cost is a big factor that people lay out, we want to make sure people know about SNAP and WIC. Certainly there's all kinds of reasons why someone might choose not to apply for those programs. They don't want to get involved with the government. There might be fears around immigration status. There might be reasons that they are below that line, but they don't qualify. So we're not talking to anyone about their specific situation, but we are providing information about how to sign up for those services if you qualify. And yeah, we would always love to see that number increase to be reaching more folks who are below the federal poverty line. And so we're just trying to stick with those outreach strategies and make sure we hit that. And this is just a chart of our host locations. Now, we do have our teaching kitchen, and so we do about 2 series a year here, but we also know that not everyone can get here very easily. And so we have spread out, this map goes about 30 miles north to south for our classes and 24 miles east to west for our classes. So especially to hit on some of that gentrification displacement that we're seeing as we see lower income folks moving further outside of Central Austin, we want to make sure that we have our classes in those locations too. We work with a lot of schools, several churches. H-E-B is the grocery store, one of the major grocery stores here in Texas. They actually help provide the groceries for all of our classes. And so as sort of a thank you relationship building with them, we do 5 classes a year at their stores. The tricky thing about doing the class at the store is it's typically where we have the least amount of control over who signs up, because they just put a flyer up and whoever shows up is our participant. But the nice thing about it is it's been a really great kind of inroads with some of our surrounding communities. So we've got all of these churches near our location that we've worked with for years. But if we want to do a class that's further out, H-E-B has been really helpful in letting us use their store conference room and have the class there. The participants also really love it because they have to go to the grocery store anyway, so they might as well do something fun while they're there. And the facilitators really love it because if they forgot an ingredient for the recipe, they can run right out and get it. There's also some community centers on there, rec centers, nonprofits, but mostly concentrated in the first 4 categories. And so our curriculum, kind of what happens when someone actually gets to the class. This is our happy plate. It's very similar to my plate that most of y'all are probably familiar with. We made a couple of small tweaks. We put milk in with the protein category because with our target population, a lot of those folks are lactose intolerant. And while milk definitely can be a part of a healthy diet, it's not something that we wanted to preach that everyone needed to have all the time. And we also show only fruits and vegetables that are located, that can be grown in Central Texas. So it's not to say that you should never eat an avocado or a banana, but it's just a really cool visual to see what you could get if you were just getting food from this region. So the Happy Plate is a theme throughout the 6-week series. We introduce it each week, bring it back to the lesson, and we don't go into super specific, this is why we eat broccoli and this is why we eat oats. It's more that if you're eating like this, you're probably getting what you need from your diet. We also talk some of the other themes and major points that we make are choosing whole grains, choosing lean protein, reducing sodium, saturated fat, and added sugars. And we also talk quite a bit about meal planning and reading labels. And so this is, everyone gets the Happy Plate handout. This is another sample handout that we made. Everyone in each class gets a packet of materials. The way our classes are structured, the first class is always themed around grains, the second is fruits, the third is vegetables, fourth is protein, fifth is fats and sugars, and the last class is kind of a toolbox class for how to stay healthy after the class is wrapped up. And so this is a handout from that last toolbox class. Of course, each session goes into much more than that. The fruits class is also when we talk about blood sugar and farmers markets. And the toolbox is where we spend the most of our time on meal planning. All of our handouts we give in English and Spanish. Even if the class is offered in one of those languages, we know there might be folks at home that speak a different one. We try to do limited text on our flyers, and to use lots of images so we can be more friendly for lower literacy folks. We also do regular updates to our curriculum. So we've got our 45 facilitators. They teach the classes in teams of 3. And there's also 2 of us on staff who coordinate all of those. And we observe one class in each series to see how it's going, how things are going over with participants, what kinds of questions they're getting. And so we adjust based on that need. And this handout is a great example. We used to have a sample menu plan. It was a grid for 7 days a week with 3 meals and 1 snack every day. So you could use that to plan your meals, but it seemed like it was very overwhelming to people. It felt like our easy menu planning guide would take you a week just to read. And so a participant asked in one of our classes, well, where do I start with my menu plan? And our facilitator says, well, I guess when I'm meal planning, I look in my fridge and see what I have. And it was like the whole class just started taking notes, writing that down, and then what? So we went back, took out the week-long meal plan and started with this. How to plan quick, healthy meals. Who are you feeding? What do you have already? What's in season or on sale? And so it's a step-by-step, how are you going to plan your meals for the week? And in addition to going through handouts like this and the general information in our curriculum, we also incorporate a label reading activity in almost every class. So if we're talking about trans fats and how even if the label of a product says 0 grams of trans fats, if you see partially hydrogenated oil in the ingredients, it still has trans fats in it, just a smaller amount than a gram. So we have labels that we pass around and have people tell us what their product is and what the ingredients are. Or we pass out boxes of breakfast cereals and we try to look for ones that have less than 2 grams of sugar, or more than 2 grams of fiber. And we talk about it that way. And that's where a lot of our facilitator training comes in, because we don't want anyone to see their kid's favorite cereal and that it's got more sugar than we're recommending and think that they've done a bad job feeding their family. It's more just about exploring and seeing, like, okay, so now you know that sugar is high, that cereal is higher in sugar than you realized. So maybe you could buy a low sugar cereal and mix the two together, or you just know that if that's the easiest way to feed your kid breakfast and you're not interested in changing, you just now know that cereal's got sugar in it, and maybe plan a lunch that's lower in sugar. So label reading, things looking at sodium, looking at sugar, looking at saturated fat, and that seems to be a big hit. Everyone's favorite is always the ramen noodles and seeing how much sodium is in that. And the recipes, so that's the nutrition side of things. Each class is supposed to be a mix of cooking and nutrition education. All of the recipes come from our cookbook. If you are interested in it as a resource, that is available for purchase. It's on our website for $26, or if you happen to be in the area, you can buy it for $20 in our office and save the shipping. So all of the recipes are in English and Spanish. They're marked with the seasonality wheel, and we talk about, that means when the recipe will probably taste the best and be the most affordable. They're marked with the nutrition facts, so you know it's healthy. The cost per serving, so you know it's affordable. Our average cost per serving is about 75 cents right now. I think the most expensive recipe is around $2 to $2.25. We show that part of the heavy plate that it fits in as well. And so during each class, people get a copy of the recipe to take home. And then if someone attends at least 5 of the 6 classes in the series, they get a full copy of the cookbook. So yeah, that getting the cookbook, if you attend at least 5 classes, is definitely an incentive to show up. If you're there in the last class and you haven't attended at least 5, you can buy the book for a discount. We do send, I just mentioned this briefly before, but after each of the first 5 classes in the series, each household takes home the ingredients for the in-class recipe. We can't send anything highly perishable like meat or dairy, and we don't send a couple of staples like oil or salt, but they get pretty much everything else. So in this beans and greens recipe, everyone would get an onion, a head of garlic, a jalapeno, 4 cups of beans, a bunch of greens, a can of tomatoes, some chicken broth, and cilantro. So they would need to have the olive oil at home, and they would want to buy the sausage if they wanted sausage in it, but they get everything else. And it is an incentive to show up. You get free groceries, and everybody loves that. But it also makes the class a lot more participatory. You get to go home, try it, see if your family likes it, make some changes, and come back and talk to us about how it went. So that's a really big hit for us. It's also if we're introducing a new ingredient like quinoa or wheat berries, it's a chance to do that first hurdle at home of making sure your family likes it before you're digging around at the grocery store trying to figure out where to get this new ingredient. We do also offer free childcare, and for classes that are only offered at one location, like some of those follow-up classes that are only in our building, we can provide gas cards or bus passes as well. To evaluate our program, right now we just do a post-only survey. We give it out in class 5 or 6, and some of the things we track are individual behavior change, like fruit and vegetable consumption, food systems connections, like whether or not people are more interested in gardening or shopping locally after the class, and then also some demographic information. And we get great results. So great, in fact, that we're looking at what other things we could track in addition to these, like maybe confidence in the kitchen. But we're consistently seeing around 90% and up of people agreeing that they're eating more fruits and vegetables, choosing more whole grains, foods with less sodium, using labels, and that they'll share what they learn too. So we also ask for any class, not just, your name, but how many people are in your household, because we know that by attending the class, you're also impacting the people in your immediate household. So these are some best practices that we've identified. I think the facilitator model is key. I know that won't be applicable to every organization. If your job is to be a nutrition educator, you're probably not going to want to go out and recruit other people to do your job instead. But if there is a way for you to work with community members, or even just bring in more stories of people that represent the community that you work with and how they made these strategies work for them, I think that's great. Our name recognition has been really helpful in the community. In the 4 years I've been here, I've seen the program go from us having to call up groups and ask, can we use your church basement to host this class, to having groups contact us and ask to host the program. Working with the community to get referrals from them has also been really helpful. Free childcare is key. Take-home groceries are exciting for everybody. And another big thing I would say is emphasis on what people can eat instead of what you can't or you shouldn't. A lot of the schools in this area, the low-income Title I schools, they have a parent specialist on staff who is always wanting to call us up and say, will you please come do your cooking class? All of my moms are just eating tortillas all the time. And that's so sad, because tortillas can be a very part of a healthy diet. There's nothing wrong with tortillas. There's nothing wrong with most foods. And so we're not doing our class telling anybody that you need to stop drinking this, you need to stop eating this, or that you have to eat this one way. It's more kind of a mind opening, like all of these things could be a part of a healthy diet for you and your family. So that's huge. And then the phone call, email, or text message reminders. We do want people to call us and sign up, but once they're on that list, we want to make it as easy as possible for them to attend. And just a preemptive, one of the questions I get most often is where our funding comes from. So this is a chart from our annual report last year. It is agency-wide, so some things like the federal contracts apply more to our farmers market programs because there's some support for the U.S. Department of Agriculture for things like that. But in general, a lot of our funding comes from major foundations in our area and grants that way. We also were at about 22% contribution, so that's mostly individual giving. That little tiny yellow is our rentals, and then the 14% is those program service fees that I mentioned. Some things that we're looking at going forward, just continuing to engage with communities of color, even as we see those communities being pushed further outside of Austin. And in line with that, offering more classes outside of Central Austin, although we are limited by where our facilitators are willing to drive. So we're not going to end up, 3 hours outside of Austin at any time soon. We want to maintain the clarity of our brand. I've seen there were maybe 1 or 2 organizations doing cooking and nutrition education when I started with the Happy Kitchen, and there's closer to 6 to 8 right now. Then there's no shortage of demand for this kind of information, but making sure people know what they're getting from each of the programs, what they're signing up for, and if that's going to be a good fit for them. And we also want to try to not have our 3 main programs of Sustainable Food Center get siloed and separate from one another. We really want to maintain those connections, and even though we know not everyone who takes a cooking class is going to want to take a gardening class, we want to keep those doors open so that people have an opportunity to engage in that way. So this is all of my contact information. You'll also have it when we send the presentation. Part of our decision to stop offering our curriculum to other organizations was also wanting to, we don't want to, just keep that knowledge for ourselves. So not selling the curriculum anymore, but wanting to continue to be a resource for other programs to talk through things that they might be developing and share more tricks and lessons learned. So it's been great to be with y'all today. If there are any questions right now, I think Sylvia is going to give me anything that came out of the chat, and then you can